This is a short video with some tips on how we do our diagnosis in our office and what clinical testing we use to determine that. Clinical testing is important because we need to gather multiple pieces of evidence about the status of the pulp and the periradicular tissues. And most of our diagnoses in our office are done by interpreting, and I do stress interpreting, the history, the radiographs, percussion, palpation, and cold. And if we stay disciplined and we do these things, I think it's crucial for any office to go through with their patients, maybe even before you do complex restorative or periodontal therapy. So this is what palpation looks like, and I always like to start with palpation because it doesn't tend to scare them too much. We're just going to gently press over the apices of the roots in the quadrant in question to see if there's any difference between them. And sometimes everything will be sore. We always ask them, okay, is there a difference between these? Does anything jump out at you? So percussion is also something that we'll do every case. And again, this is something that scares them a little bit more. And we're looking for differences. So it's important to test several teeth in the quadrant. And this is what percussion looks like. And then we have the assistant write that down. The third test that we'll do almost all the time is cold. And there's a few ways to do that. You can use ice sticks, you can use ethyl chloride, or you can use CO2. We like the tetrafluoroethane spray, the refrigerant. And that comes in a couple different varieties. You can have endo ice, which is available for most dental supply companies, or you can use the canned air that is sold by computer electronic companies to clean off keyboards. It's the exact same thing. It's minus 26 degrees centigrade. It's easily stored and it's easy in application. And this is how we use the canned air spray. It has to be held upside down and the assistant can hold it. And then we place the cotton in front of the pipe coming out of it. And now that cotton is minus 26 degrees centigrade. And we go directly to the mouth and test the teeth. So this is what it looks like clinically. Most of the time we're applying it to the buccal surface. And you can see it's nice and cold there.
There you go.
And we're having the patient either raise their hand or let us know. And these are responding a little quicker than most. Usually it takes about 5 seconds to do. And I always start on teeth I least suspect and then work back to the one that we most suspect. So in summary, I hope this is just a nice little quick video on how we get a lot of information really quickly. And this is something that I think really should be routine before any involved work is done in a quadrant, maybe even every crown prep, and I would say certainly every periodontal surgery. We need to know the status of the pulp because a lot of times a necrotic pulp will not be symptomatic.